See, morbidity can be definitely prevented today. As I told you beginning, that today nobody nausea and vomiting after chemotherapy is rare because we have very good support. Today nobody dies because of the low WBC count. We have the drugs which stimulate the WBC count and platelets. So our support system has remarkably improved. Today I don't care if the patient WBC count becomes 0 because I know he will come out of that with all the support care. So it has given us a good support care, has given us a confidence to treat our patient more effectively.
I think radiology is playing an increasing role in heart diseases, in cardiology, both predictive as well as therapeutic, preventive. We have, echocardiography, we have stress echo, we have CT coronary angiography, where non-invasively with a small injection, we are able to look at the coronary arteries, see the deposits of plaque within them. Is it calcified? Is it fatty, lipid? How much is the risk? How much is the degree of narrowing? And it's become very, very good. We've ourselves been doing it over the last 23 years, and it has come a long way. And again, nuclear medicine also, coronary narrowing, if it occurs, nuclear medicine procedures like stress myocardial perfusion scans are able to show what is the effect that narrowing has on the muscles of the heart. MRI is playing a major role in certain cardiac conditions. So really, I don't think cardiologists can move without the help from radiologists.
More than anything, corporate hospitals have to play a role in getting the message out, which is heart surgery is something to be feared, but it's not something that is unavoidable. Indians are genetically 3 times more vulnerable to heart disease than Europeans, but it also means that this is something we should all be born with common knowledge of. And so knowing that this is a problem means you can start incorporating healthy behavior much earlier on and get regular screening, so that should the day come where either your lipid profile or your CT scan indicates an area blockage, it can be corrected much earlier.
India stands at a very critical juncture when it comes to dealing with cardiac diseases. We are at a point in time where our capabilities, our technology, and above all, our intent is strong to address this situation. The incidence of cardiac diseases is no longer confined to a segment of the population, be it only the elder segment or in urban areas. It is spreading across the population, across towns and villages. We have to address this on a mission mode. We have to address this using smart technology to enable clinicians to prevent cardiac diseases, and the best way to do that is timely diagnosis. With the tools that we have at our disposal already today, we can and must do more to address this national topic of cardiac diseases and cardiovascular diseases. The TOMTech technology, the EPIC CDX, are technologies that enable clinicians to detect mild variations in cardiac rhythms, which will enable earlier detection and prompt addressing of cardiac diseases in the country. AI is an amazing accelerator in providing cardiac care, both preventive and curative, to patients across the country. AI used smartly can enhance not just the capability to prevent, but also to quickly treat and reduce the recovery time for patients in India. Prevention is the best way to address cardiac diseases. And using technology as an ally is going to be the solution for us to address this national topic.
There's a lot of myths around heart health, and we are seeing a lot of young heart disease patients now, a lot of young deaths which get publicized a lot on social media, which leads to more anxiety. So I think we just need to, one, reassure all the young people that don't worry too much. Second, please do not stress out yourself over either work or health also, because sometimes we stress ourselves so much on health that we fall sick. Third, please do not smoke. I've been pleading with the youngsters, do not smoke. I mean, smoking is the worst thing possible you can do to your body. So alcohol, cigarettes, etc., try to avoid, and include some sort of exercise. Preferably play a sport like I do. I play sport every day. So preferably choose a sport which is, even more preferably, a team sport where you get to meet new friends, you relax with them, you laugh with them. It's like a meditation, because when you are playing a sport for 1 hour in the morning, you can really not think of the stress at work or stress at home, and you just are in the middle of that. So I think if you can include any sport in your daily curriculum, that will make sure that you never go to a doctor. So I'm not a big believer in these big health packages that get thrown out at people. I don't think they're very useful, and please don't waste your money on them. But of course, once you have crossed 30, then you should go and meet your doctor definitely, and the doctor can assess you much more and advise you the right tests to get done. After 40, you should definitely get your lipid profiles and thyroid, and preferably an echo and ECG also done. And after 50, please meet your doctor every 6 months and do whatever the doctor says.